Hey, Alex, welcome back. It's nice to see you again. I appreciate you taking the time to meet with me today. We're going to have a pretty content-heavy session today because I would like to administer a diagnostic tool, which we'll talk about at great length. It's the DSM-5, CAPS-5 past week version, which is a clinician-administered PTSD scale. But I wanted to take a second to sort of talk about the sort of basics of our time together, just to remind you some of the rules of the road. Is that okay?
Yeah.
Okay. So again, as I mentioned last week, everything that happens in here is confidential, with the exception of if you talk about hurting yourself or someone else, in which case I will have to get folks involved, just as a for your safety and the safety of others. And as I mentioned before, I'm a student clinician, so there may be times where I will need to break our confidentiality to speak to a supervisor just to make sure that I'm giving you the best treatment possible. And as I'm learning, I may need a little bit of guidance. So is that okay with you if I break confidentiality that way?
Yeah, that's okay.
Great. So I want to start our session today just with a really quick assessment of where you are in terms of self-harm. Have you had any thoughts recently of killing yourself?
Not recently.
Okay. When could you tell me when was the most recent time that you had those thoughts?
Probably years ago.
Okay. Okay, great.
Not
So I
in a
just
long
want to
time.
Okay. So I just want to make sure that you know that this is a safe space. The thoughts are thoughts, even plans are plans. But if you ever feel like that's something that you want to talk about, this is a safe space to do it. And it doesn't mean that I don't want you to feel like it's not something that we can discuss openly and honestly in the context of our work together. So I'm going to be doing a lot of talking at you, like just for now, and then we'll transition and you'll answer questions if that's okay.
That's okay.
It's a very structured diagnostic tool. So the what this is is a way to walk through. As you know, you have a diagnosis of PTSD, and you've had quite a bit of trauma in the last years, several years, and certainly recently with the loss of your mom. And again, so sorry for your loss. But what we want to try to do is we want to try and understand the intensity of the PTSD symptoms that you're experiencing so that it can inform the treatment plan that we develop as we um, as we walk in our journey together. Okay.
Okay.
So some of the stuff I'm going to read is going to sound a little bit canned, but I beg your forgiveness for the sort of fidelity of the intervention. I want to make sure that what we're doing is exactly as the intervention and as the assessment is intended to be. Okay, so some of this is going to be a little formal, a little cheesy. Just warning you now.
Okay.
So
Thank you.
I'm going to ask you, and the other thing I want to say is if you need a break, you know, tell me you need a break. Tell me that, we can do some grounding exercises. We can do like the 5, 4, 3, 2, 1. We can do some deep breathing together if things become a little too intense. Fair enough?
Fair enough.
So I'm going to ask you about the stressful experience questionnaire. You've filled out for me already. First, I'll ask you to tell me a little bit about the event that you said was worst for you. And then I'll ask you how that event may have affected you over the past week. In general, I don't need a lot of information, just enough so I can understand any problems that you may have had. And please let me know if you find yourself becoming upset. As we go through the questions, we can slow down and talk about it. Also, let me know if you have any questions or don't understand something. And unless you have questions before we start, let's dive on in.
Okay.
Okay. So the event you said was the worst for you was the childhood abuse that you experienced by your babysitter.
Yes.
What I'd like you to do is briefly describe what happened.
Okay. So, when I was a kid, I was playing and my babysitter had me come up and sit with them, and the babysitter um did take off my bottoms and touch me inappropriately.
Do you remember approximately how old you were? It's okay if you don't.
I think I was 5.
How many times did this happen?
It happened 4 different occasions with the same babysitter.
And I know this is really difficult, um, but do you remember anything about, um, was the touch the same each time or was it different?
Mm, it was probably similar each time.
Do you ever feel like your life was in danger during these moments?
I think I did, yeah. I felt the fear for sure
Tell me more about
that
that.
comes along with that.
What was the fear about?
I think the fear was mainly rooted in confusion. I didn't understand what was happening, what would happen after, or why. Um, if it was punishment for something, or if I was, I just knew I was being hurt in some way.
So you knew that you were being hurt,
Yes, I knew I was being hurt.
and you said that sometime you were wondering if it was punishment.
Yeah.
Did the touch hurt?
Sometimes, yeah.
Thank you. I know that that's a really difficult thing to talk about, and I appreciate you being so honest and direct with me. I'm just gonna make a note or two, and then we'll move on. Okay? Won't you
Okay.
take some time, do some breathing in and out, and we will move on. For the rest of the year, I want you to keep that sexual abuse by the babysitter in mind when I ask you about different problems that may have caused you. You may have had some of these problems before, but for this interview, we're going to focus on just the last week.
Okay.
For each problem, I'll ask you if you've had it in the past week, and if so, how often and how much it bothered you. Okay?
Yes.
So, um, in the past week, have you had any unwanted memories of the sexual assault while you were awake? So, not counting your dreams.
Yes.
And how many times?
Probably 3 occasions that I can remember where I had to go and like take myself out of it and make myself focus on something else.
Mhm. So, how does it happen that you start remembering the event?
Typically, it can come sort of out of nowhere, but I think it's with a sound most of the time. Sometimes a smell, but I can't pinpoint exactly what the smell is. When I hear um children's TV shows, that often will bring it on because those
Mhm.
would always play.
Yeah, I can I can imagine how difficult that is. And are these unwanted memories, or are you thinking about the event in person?
I mean, I don't want to think about it, but they do make me think about it.
How much do these memories bother you? Like, are you able to put them out of your mind and think of something else, or how much do they bother you, like on a scale of 1 to 10?
Probably 3. I'm able to put them out of my mind, but it changes my mood after the fact. I'm not present in what I'm doing anymore usually. So it affects me like if I'm with my girlfriend specifically.
Okay, so you're able to put them out of your mind, but it impacts you particularly when you're with your girlfriend.
Yeah.
Overall, how much of a problem of these unwanted memories, how would you rate them? Like, are they minimal? Are they clearly present, they're pronounced, or would you say that they're extreme?
It kind of depends on the week, but in the past week, I would say they bothered me probably on a scale of 1 to 5, like a 4. They were bothersome this week.
I would probably rate that. Like, and you had mentioned that you'd had these memories about 3 times in the past week.
Yeah.
Okay. Okay. So great. Let's move on to dreams. In the
Okay.
past week, have you had any unpleasant dreams?
Yes.
Can you describe a typical dream? What
Yeah.
happened?
So I have them both about my mother passing away and about the abuse, but sometimes in the dream I'll be a child again and I'll just be running around the house and then I know that the babysitter is there and there's nobody else there with me. And I start to get really fearful and I go and hide and um then I'm stuck. It's like I'm stuck in my room and I can't get away and they're coming.
Do these dreams wake you up?
Um, yeah,
What do you experience when you wake up?
a lot of fear and I feel like it takes me a second to like come out of it and realize that I'm an adult and I'm safe.
And how long does it take you to get back to sleep?
It sometimes a long time, probably like up to an hour. Sometimes if it's early in the morning, I won't go back to sleep.
How much sleep do you lose on average when you have these kinds of dreams?
I say up to an hour. It can be like an hour, or it could be sometimes if I don't go back to sleep, it could be 3 hours, 4 hours.
And on that same sort of scale, how much do these dreams bother you? Would you say it's minimal,
The
clearly present, pronounced?
dreams, probably 4. I would say it's up there. They bother me.
Pretty pronounced. How often do you have these dreams in the past week?
In the past week, I had it 3 times.
All right, let's take a deep breath and let's dive in to talk about um, some reactions that you may be having. In the
Okay.
past week, have there been times when you suddenly acted or felt that the sexual assault and abuse were actually happening again? This is different from thinking about it or dreaming about it. Now I'm asking about flashbacks when you feel you're actually back in that moment, actually reliving it.
Yes, I do.
How much does it seem as if it's happening again? Are you confused about where you actually are, or is it clear? Again, not in
Um,
your dreams.
I don't I think less like about like where I'm at because I'm just so like caught up in it. So I guess I would say that I have to come out of it, like I have to snap out of it to like realize where I'm at because I start to have the feelings of fear as though I'm really there.
And what do you do while this is happening? Like, do other people know it's happening, or is it a kind of
No,
an internal?
I go to the bathroom usually if I can.
If there's no bathroom available, what do you do?
Um, try to find a space where there's not people, go stand in a corner. Um, go on my phone, like pretend I'm taking a phone call to like try to like make myself come out and like let it pass a little bit.
Yeah. How long does that last?
It can be anywhere from up to like five minutes.
Mm.
Sometimes it's quick, sometimes it's not. Sometimes it's, 1 minute, sometimes it's like 5.
Thank you for sharing that with me. How often does this happen? Did it happen in the past week?
Yes, it happened one time in the past week.
Okay. So, let's talk about, in the past week, have you gotten emotionally upset when something reminded you of sexual abuse?
Um, yeah. I think typically with those memories and the flashbacks, I feel I end up upset after. Um, Also the dreams. I will be
So,
emotional after usually.
so the memories, the dreams, and the flashbacks can make you upset.
Yeah.
So, how much do these reminders bother you, approximately? Scale of 1 to 5.
Um, I mean they interrupt my daily life.
Mm-hmm.
So I'm usually able to finish my day after I have them, out of necessity to be able to finish my day, but I would say they upset like a 4, they upset me.
Mm-hmm. And how long does it take you to calm down after that happens?
Um, it varies. Sometimes, usually about 10 minutes. That's why I usually go to the bathroom and then I can calm down in there and then rejoin the group if I'm with people.
How often has this happened in the past week?
That I've become emotional. Probably maybe 1 or 2 times. Once waking up from a dream, once after the flashback.
So we're moving along. We've got a little bit to go, but I appreciate your patience with me.
Thank you.
So in the past week, have you had any physical reactions when something reminded you of the event?
Um, yeah. I struggle a lot with intimacy with my girlfriend Emily.
Can you tell me a little bit more about what that means?
Yeah. So sometimes um I just don't crave intimacy, and I know that she does. So like if we're kissing or something, um I start to kind of freak out and get really stressed out because want to have to I don't want to have to do anymore.
Does it mean that you have a body reaction? Like, is your heart race, your breathing change, sweating?
Yeah. Yeah, I start to get really stressed out and I like push her away, but then I shouldn't be doing that because it's, not her fault.
So, just to sort of reframe it, so is it the triggers are initiating intimacy by Emily?
It's anticipating the intimacy, yeah.
How long does it take you to recover, General?
A couple of minutes, 10 minutes sometimes.
How long did it happen in the last week?
Um, 2 times in the last week. I keep saying that I really want to have that relationship,
Mhm.
but in the moment I start to get really overwhelmed
Yeah,
anticipating it.
absolutely. I totally understand that, it's a difficult situation that you're in, and hopefully you and Emily are able to support each other in those moments of difficulty. Do you feel supported in your relationship with Emily?
Very much. Yeah, she's very patient with me.
That's Um, okay, so we're moving on to a new criteria, which is avoidance of stimuli. So in the past week, have you tried to avoid thoughts or feelings about the sexual?
Yeah, I typically try to avoid it because I get so overwhelmed and emotional. So I will not drive past like my old childhood house very often. I try not to, so I'll go, which is inconvenient because I live near it, but I'll go a different way to not pass it. And I avoid anything having to do with like I don't like a daycare center. Um, I don't
Mhm.
prefer to be in those environments. I don't get triggered seeing people's children, but I just don't like the whole child environment. I don't I kind of avoid that whole scene.
Yeah, I get it. Um, how would you characterize this in terms of being a problem for you? How would things be different if you didn't have to avoid these thoughts or feelings?
Well, I would get to work faster,
Mm,
get most places faster. I would be able to be more involved with my nieces and nephews. Um, and you know, um, just my life would be easier in general for sure.
yeah, I totally hear you. How often in the past week um, did you have these avoiding feelings or thoughts?
Um, Pretty much, I mean, there was a birthday party for a
Hmm.
relative's child that I pondered over whether to go to or not, but I had just had a dream, so I decided not to go. So that was one. And then um, driving around and not going by my childhood house.
So there was there's two times last week.
A couple times with the driving, probably three with the driving.
So we talked about your avoidance of the concrete spaces. So you said that you feelings of overwhelmed and emotional, and you talked about not trying to so avoiding daycares and avoiding your childhood home. Um,
Mhm. Stuff with that children's music from the
mhm.
children's shows. That's like, I don't like any of that.
Uh, Thank you so much for bearing with me.
Thank you.
So you would say that you make a big effort to avoid these reminders. You
Yeah.
change your activities or avoid
Yeah. I'm mad at myself for missing that birthday party. That was a big effort to avoid.
Yeah, I definitely hear you, and some of the work that we can do, and I'm glad to hear that you're sort of thinking about these things. Some of the work that we can do together is to make plans to help process those feelings and process some of the feelings underneath, and seeing how we can give you some coping skills to maybe not avoid those things, but approach them cautiously. Does that
Yeah.
sound like a good plan for the future?
Yeah, I think so.
Um, and you said about 3 times last week.
Plus the birthday party. So for
So
avoiding.
Um, so in the past week, have you had difficulty remembering any parts of the sexual trauma? Just remember in the past week.
Um, in the past week, have I had difficulty remembering the like different parts of it?
Hmm.
Kind of, yeah. I sometimes like doubt how much I remember the story. Like if it happened in the way that I'm thinking. Like I have those flashbacks where I feel like I'm there again and like I know what happened, but then I also don't.
So
Um,
you doubt the narrative in your
yes, I doubt the narrative. And I have difficulty concentrating because it upsets me when I don't feel like I can remember everything right.
Yeah, I can I can totally see how upsetting that would be. So this question may seem kind of strange, but do you feel like you should be able to remember those things?
Hmm. I feel like it's frustrating because it's not like I can ask somebody else who was there what happened
And certainly,
to confirm. It's all
are
in
you in?
my.
Have you been in contact with the perpetrator? So when those things were happening, did you do you remember if you were knocked unconscious or intoxicated? Was there anything like that going on? And it's okay if you don't remember.
I don't think so, but I don't remember exactly.
Do you think that it's just kind of normal forgetting because this happened when you were a child, or do you think you may have blocked it out because it might be too painful to remember?
Potentially blocked it out. I'm not sure. There are definitely holes in the story.
In the past week, how many of the important events of the sexual abuse have you had difficulty remembering?
Um, Probably at least a couple. Um,
Okay, we can say 2 to 3.
okay.
What parts what parts do you think that you still remember? Like if we're thinking about our senses, right, of the five senses, what do you remember?
I remember the show playing. I remember um feeling the fingers on me. I remember seeing my childhood living room and my childhood bedroom. Um, I remember just smelling my childhood house.
Hmm. Of
So
the things that you forget, do you think you'd be able to recall them if you tried?
maybe I
Okay.
forget what was going on before it a lot. So I get very stressed out about like anticipation because I don't know exactly what brought it on, and that's like when I was a kid I thought it was like punishment, so
Hmm.
I get confused about like what caused it, what led up.
I got you. Okay. In the past week, have you had strong negative beliefs about yourself, other people, or the world?
I definitely feel like the world is not a good place in general. I think there are good people, but I haven't felt like the world is trustworthy. And definitely doubt that I'm like a good boyfriend to Emily. Um, I really love her, but I'm
Hmm.
not providing her the relationship that she deserves. And I think a lot of times that I just shouldn't be in a relationship at all.
How convinced are you that these beliefs are actually true?
But I think they are completely. I mean, it's basically facts.
Do you think that there are any other ways of thinking about it?
I mean, Emily thinks about it like that, you know, we're partners and both of us have stuff that we're not perfect about.
Hmm.
But I mean, the fact is, I am not a functioning boyfriend in the way that I should be.
I got you. How much of the time in the past week have you felt that way as a percentage?
Pretty much every time I'm with her and when I leave and at night.
So is that like
So
50% of the time, 60% of the time you spend
60%
like
of the time, yeah.
60%? Okay. Do these beliefs start to get worse? Like, did these beliefs, I know this is going to be a really, really difficult question to answer because you were a child and now you're not, but did these beliefs start or get worse after the sexual assault? So
I
definitely,
think that
probably,
the world one started, yeah. And I never had a really, like, after I thought that, I wasn't safe anywhere. If you're not safe in your own home, then you're probably not safe anywhere. And then Emily's the first relationship that I've ever had. Um,
mhm,
so I've always thought that I, wasn't good for her. But
yeah,
I really do want to build a healthy and loving relationship, and she wants that too. I just feel so bad for her that she has to be with me.
yeah, I hear you. We are about halfway through. Do you need to take a second to breathe?
I'm okay.
Okay.
Yes.
Thank you for sharing that. That's a difficult road that you're on at the moment, and I appreciate you being so open and honest about it. In the past week, have you blamed yourself for the sexual assault or what happened as a result of it?
Um, I start to, but then I do recognize that I was a child and it wasn't my fault. I do wish that I had um told somebody, but
When did you tell somebody?
um I never told my parents the full story,
Mm.
but I did tell them that I got spankings from that babysitter. And they didn't like that, so the babysitter went away.
Did you actually get spankings, or is that something that you created as a okay? So you blamed the babysitter for the sexual assault. Um,
Hmm.
um, in what sense did you see so that what they did you saw as the sort of as the perpetrator of this, right? And
Hmm.
you said that you manufactured the story about the spanking to get away from it.
Yeah.
Thank you so much. How much do you blame yourself for what happened in the past week?
Um,
And it's okay to say that you don't.
Probably I do a little bit. I wish that I had told the full story, but now I never can. Um, I wish that I had said something right away.
How much of the time in the past week have you felt that way?
Um, Probably all the time. It's like a lot of regret. So a lot of the time.
In terms of percentages, would you say it's like 90%, 100%, 80%?
80%.
All right. Um, in the past week, have you had any strong negative feelings such as fear, horror, anger, guilt, or shame?
Definitely the fear and the anger. Yeah.
Can you give me some examples of the negative feelings that you've experienced? I know you talked about
Mhm.
what you experienced when you were a child, but this past week.
After my dream, and I was just feeling really angry, and I feel really angry because of Emily, and that I feel like I think about like what it would be like if I wasn't this way. And it makes me really mad because things could be so good and they're just not.
Would you say that mad feeling is strong,
Hmm.
or
Very strong, yeah.
and how are you able? How well are you able to manage them? Like, how much of a problem is that for you?
The mad feeling is not a huge problem. Um I'm able to like get over it. I just kind of manage it in the same way that I manage my other emotions. Like I just get myself in a quiet place and I just like try to calm myself down.
It sounds like you're doing a lot of self-soothing. Um, how much of the time in the past week have you felt that way as a percentage of time?
Um, Probably 50%.
And did these feelings start or get worse after the event? After the sexual
Start.
assault? Okay. In the past week, have you been less interested in activities that you used to enjoy?
Mm, I I really love my hobbies. I just haven't been doing them as much, but they definitely are like a good part of my life. I just
Okay.
haven't done them this week at all.
But in the past week, have you experienced like a marked decrease or in the interest, or was it nothing special?
Yeah, this week I was less interested. I
What
was
kind of?
supposed to play my guitar and then I had that nightmare and I didn't go back to sleep and I
Mhm.
didn't play it.
And you said that you had a nightmare.
Hmm.
Would you still enjoy the activities once you got started? If
Yeah,
you,
yeah, once I get started, it's just getting started.
over the past week, how many of your usual activities have you been less interested
Well, I was supposed to play guitar.
in? Hmm.
I was supposed to go for a hike and I had gotten a new canvas and I was going to paint and I didn't do any of them. So all three probably.
Hmm.
I usually feel better after I do them, but I just for whatever reason didn't do them today.
What kind of things are you still enjoying doing aside from the things that you named? Is there stuff that you're still doing that you enjoy
I
besides the
see
guitar?
Emily hanging out with her.
Okay. Sorry, for like a second, I thought you said that you saw her right now, and I didn't know if we
Oh,
could use that.
no.
Seeing
When I see
Emily.
her, I enjoy that.
Okay. Good. Did the loss of interest get worse after the event? Did you do those things when you were a child?
Um, I liked art when I was a kid, so I would do crafts and stuff. Um, and then I stopped. I didn't do them all the time, but I've tried to get back into it because it does help me feel better. But the guitar and the hiking I've picked up as I've gotten older.
So again, some of the questions I'm going to ask are going to feel a little bit repetitive, but I again appreciate your patience with me as we go through the last third of this assessment.
Okay.
Um, so in the past week, have you felt distant or cut off from people?
Um, yeah,
Yeah. So
yeah,
you mentioned a few times that you felt a little distant from Emily.
yeah, that's the main one.
Anybody
Also, my
else?
um my father.
So are Emily and your father the people you feel closest to?
Yeah, but I'm not that close with my father. I'm more with Emily.
How many people do you feel comfortable with talking about your personal things?
Really only Emily and when I come to therapy.
How much of the time have you felt that way? Like just the percentage of your time?
All of it. Yeah. I feel uncomfortable with um
Okay,
people sometimes.
I gotcha. And do you think that this feeling of being distant or cut off started or got worse after the sexual assault?
I do. I think it probably started from that.
In the past week, have there been times when you had difficulty experiencing positive feelings like love or happiness?
Um, Sometimes like after something happens, but I do like to think that I'm happy with um when I'm with Emily and yeah.
Okay. So which one of those feelings are the most difficult for you to experience? Love, happiness?
Mm, happiness.
And how much difficulty are you still able to experience? So I guess the question is, you said that sometimes it happens, but you like to think that you're happy. Are you still able to experience those positive feelings of happiness?
Yes, I can still experience it.
Did this trouble experiencing positive feelings start to get worse after the sexual assault?
Um, yeah, I think it started. I think I don't remember a lot because I was younger, but
Mm-hmm.
I definitely think it started from that.
Okay. In the past week, thank you for hanging in with me. We're very close. In the past week, um, have you um, experienced anger?
Yes.
Would you tell me the irritability and anger? Can you tell me like some examples?
Yeah.
How do you
Um,
show it?
I feel it when I feel it myself after Emily leaves and I feel mad that I'm not good for her. And I feel mad when I have the dream that I can't or when I can't sleep. It's frustrating.
How do you show it? Do you raise your voice? You yell, throw things, hit things, push or hit people?
Um, I no,
Okay,
I just like feel it and like just go lay down.
okay. So it's
Sometimes and then
more
I
feeling rather than an expressed behavior or angry
yeah,
outburst. Okay. How often did that happen in the past week?
like probably like 5 times. I just go lay down.
Okay. But you never expressed your anger physically. Did you express your anger physically at all this past week?
I like hit the table and like yell and then walk to my room.
You would say that happened a couple of times.
Yeah.
In the past week, have there been times when you were taking more risks or doing things that might have caused you harm? And it's okay if not.
Um, no, not really.
In the past week, have you been especially alert or watchful if there was no specific threat or danger? Have you felt like you have to be on guard? Yes.
Mhm.
Can you give me
Yeah.
some examples?
I'm pretty much on guard 24/7. I just look around. I don't really feel like fully safe anywhere. So I definitely like I don't feel safe like in the world. So I just kind of am always
Hmm.
like I always look around. I'm always thinking about like where is the exit? I'm always like waiting for something to happen.
So you would say that you don't feel fully safe in the world. Do you feel that way more than most people would in the same situation?
I think so, yeah.
How many times in the percentage of your week did you feel that way, approximately?
Mm, like close to 90. I don't really anywhere
Okay,
except for when I'm with Emily, but still also not
sure.
completely.
Do you think it's related to the sexual assault that you experienced? Did it start or get worse?
I think it probably is related. Yeah. I can't remember feeling that way the before that happened.
In the past week, have you had any strong startle reactions like jumpiness?
Yeah.
Yeah. Okay.
Yeah.
What kind of
Typically
things do you
little things will get me and I'm jumping.
little things? how strong are they compared to how most people would respond? Is it
They're
anything
not a
different?
lot. They're not a lot stronger, but they definitely are more noticeable. And I feel like I can't control them. Somebody comes up behind me, do that, and it's like not always appropriate. I guess I
Mhm.
worry.
How long does it take you to recover?
Um, Anywhere from 1 to 10 minutes.
How often did this happen in the past week?
Um, like every day.
Okay, that's
So probably,
challenging.
yeah.
Do these startle reactions, did you think that they were like that when you were a child, or did they happen as a result of the sexual assault?
I think I've grown into them since the event.
In the past week, have you had any problems with concentration?
Yeah.
Can you give me an example?
Um, yeah, I have a hard time when I'm working. I have a hard time focusing. I like zone out from my
Mhm.
work. Um, and I just like sometimes I think about other things. Sometimes I just sit there and I am not thinking about my work, but that can happen for a couple of minutes at a time. Um, and then I feel like when I'm talking to somebody, I'm not able to always like if it like especially if it's about work, I'm not always able to like concentrate or like remember what we're talking about.
Are you able to concentrate if you really try?
Yeah,
So overall, how would things be different for you if you didn't have problems with concentration?
I'd probably be better at my job and I would be more confident because I would be, able to present my thoughts well to people.
How many, how much time percentage of the past week have you had problems with concentration?
Probably like 60% of the time.
Yeah, so that's a real challenge. Um, do you think that the problems with concentration started or got worse after the sexual assault?
Probably started and got worse.
So you mentioned that you have sleep disturbances about falling or staying asleep, but you said about 3 times, right?
Hmm.
How long does it take you to fall asleep?
Um, it can take like an hour, or sometimes I can't fall back asleep, so I just get up for the day.
Yep. So it takes you an hour to fall asleep initially, or it takes you an hour to fall asleep after you have a nightmare?
After something,
Do
yeah.
you wake up earlier than you usually want?
Yeah.
How many total hours of sleep on average would you say you're sleeping?
Mm, 4, 5.
Okay. How many hours do you think you should be sleeping?
I know like 7 or 8.
Mhm. Yeah. How many times? I think you mentioned that you in the past week you had 3 issues with sleeping.
Hmm.
Do you remember when you were a kid? Did you have problems sleeping?
Yeah, I would stay
So
up. Yeah,
did it get worse after the assault?
yeah.
And so just to be clear, you still had some trouble sleeping when you were a child, but it got worse after.
Yeah, I think it was like normal trouble sleeping like that kids have, and then I never grew out of that.
Um, so we have basically 5 questions left,
Okay.
and they're gonna go pretty quickly. Um, Overall, in the past week, how much have you been bothered by the symptoms that you discussed with me? You talked about sleep problems, some anger problems, you have some concentration problems. So, in your head, would you rate it a 0, none, mild, minimal distress, moderate distress, present but kind of manageable, severe, considerable distress, or extreme incapacity? How would
Probably
you rate it?
Severe.
Severe. In the past week, have these PTSD symptoms affected your relationship with other people? The same scale. No adverse effect, mild impact, moderate, severe, or extreme.
Severe.
I think that I share that assessment with you. So I just want to I'm going to capture some of the sort of occupational things. You said that you're working now, and you said that the past week, these symptoms have affected you at work or your ability to work. Yes?
Yes.
So concentration. Have these PTSD symptoms affected any other important parts of your life besides your relationship with Emily?
Um, Probably my like keeping up with um like cleaning and like those types of things and just like productivity in general.
So you would say that it's probably still in that severe category,
Mm, and maybe moderate.
maybe moderate. Okay.
Hmm.
Okay. Estimate the overall the sense that you have um, of how you would your life would improve. Um, sorry, I beg your pardon. Um, I apologize. I got a little thrown off by the questionnaire. Just two more questions for you, and then we're good to go.
Okay.
In the past week, have there been times as if you were separated from yourself, like you were watching yourself from outside or observing your thoughts and feelings as if you were another person?
Late at night, yes, there are fun times.
Can you tell me more about that?
Hmm. Um, Mainly it's connected to like the dreams, like when I have the dream and then I come out of it, um, I feel like I'm not like there and like I can just see myself and like I'm like not happy with it.
Do you lose track of where you actually are and what's actually going on? Is it pretty strong?
No, I don't lose track of where I'm at. I know where I'm at. I just like feel like I see myself just like laying in my bed,
Do other people notice that it's happening? Is anyone around when it's happening, or is it just happening at nighttime?
just happening at nighttime.
And how long does it typically last?
Couple of minutes.
Was this in any way due to effects of alcohol or drugs?
No,
Do you have any medical conditions like seizures?
I do not.
Are you taking any over-the-counter medication of any kind to help you go to sleep?
Um, Sometimes melatonin, but not typically.
Okay. How many times did this kind of feeling where you're outside of yourself, coming out of your dream, had this happen at night? How many times this past week?
Like two.
Did you have these kinds of feelings, or did you have these kinds of experiences before the sexual assault, or only since?
Only sense.
And this is our last item, and then we'll both take a deep breath together. And in the past week, have there been times when things are going on around you that seemed unreal or very strange or unfamiliar?
Um, Kind of, yeah. I think I'm the one that feels strange in the
Mm-hmm.
world. But this it more moderate. Like I've learned to be able to like be okay where I'm at after I kind of regroup and come down.
Do things like are things going on around you seem like a dream or seen from a movie? Do they seem distant?
Mm, um, Kind of, yeah.
Which
I
one?
have to make sure that like I have to like think like okay, like this is somebody is like walking towards me, like, but
Mhm.
they're not talking to me, they're just walking past me, like that
Got
this is a normal thing in the work environment.
got it. Do other people notice the behavior?
I think I probably just look kind of odd. I don't think so though. Nobody's ever said anything to me.
And how long does it usually last?
Um, a couple of minutes.
And again, was this due to the effects of alcohol or drugs or any medical conditions?
No, it wouldn't be.
And how often does it happen in the past week?
Um, Probably like 3 times.
And do you think that this happened before the sexual assault, or did it
No,
start?
probably not. I think after.
Okay. Thank you so much for taking the time to go through that. How are you feeling now that we did this really heavy thing?
I'm feeling a little bit anxious, but I'm definitely hopeful that like this will be helpful and we can move forward a little more. Um,
Hmm.
so you got me thinking about like when you said what would things be like if I didn't have to avoid driving by my childhood home. And I kind of saw I kind of got hopeful that maybe like there could be a different um differences in the future.
Yeah, I I definitely appreciate you, kind of thinking about those kinds of things, and it's a great step to even kind of imagine a time where you could not avoid those things. Something to think about before our next session. And again, I'm available to you in between now and the next time we meet. Um, but something to think about is like, what would it look like to drive by without noticing? How would that feel? And I don't want you to necessarily do it, but I want you at least to have some thought exercise about what you think the emotion you would experience is, and how that emotion might express itself in your body, in your brain, how you might cope with it if it's something that had to happen. Like if we found a way to make it something that was completely unconscious, like what would that look like? Just a thought
Yeah.
experiment, something to think about. You have your thought journal. I know that you talked about writing things down sometimes. Definitely a
Yeah.
great idea to do so, and certainly bring those to our session the next time we talk. And I truly appreciate your patience. Thank you. You've been a trooper.
Thank
Please
you.
let me know if there's anything I can do to support you going forward. I'll see you next week.
Thank you. I'll see you next week.